There are two large trials going on in adult brain cancer right now. One is for patients with lower grade gliomas, meaning brain tumors that are less aggressive, where these patients really are, we predict that they're going to live a very long time, and they have a certain mutation in their tumor called an IDH mutation. We are running a trial along with other centers throughout the U.S. where we look at these patients and we randomize to protons or traditional IMRT radiation. And the question we want to ask here is twofold. One, we want to ask, is protons really better in sparing that normal brain tissue? And does that lead to less side effects in terms of problems with learning and memory after radiation, which we can occasionally see? The second is we want to make sure that the disease control rates or the tumor control rates are really the same with proton therapy or compared to IMRT or traditional radiation. The second clinical trial is also a national trial that is looking at increasing the radiation dose for patients with glioblastoma. On that trial, patients may be treated to a higher dose with proton therapy, and we hope that that might lead to improved disease control, better tumor control in those patients. Ultimately, we think that future patients with brain tumors are going to be the ones that benefit. For the first trial, looking at the lower grade gliomas, if we can show that protons have better outcomes in terms of less problems with learning and memory, that's going to be a really important question, and it's going to, I think, help provide evidence that we need to continue to expand the use of proton therapy in brain tumor patients. For patients with more aggressive tumors, such as glioblastoma, if we find that we can safely deliver a higher radiation dose with proton therapy, that may lead to improved disease control outcomes. And so it's going to benefit not only the patients on trial, but potentially the patients that come with similar tumors afterwards.